All right. Well, this broadcast is about diabetes and the warning signs and risk factors of diabetes. Now, working in the healthcare industry for over 2 decades, I've had the chance to see thousands of patients suffering from nerve pain. Although my background is primarily musculoskeletal, many of these patients experience nerve pain that was caused from other issues besides neuromuscular problems. It was affected by their blood sugar levels. It's become more and more important to diagnose patients who are prone to diabetes and to stop the causes of diabetes before they cause damage. As a physician, if you've experienced two or more of the symptoms that we're going to be going over, then you need to stop and schedule an appointment to get yourself checked out. So let's go over some of the symptoms. Symptoms can be as simple as you find yourself excessively thirsty. This is not only with increased exertion, but can be after simple activity. The next is you seem to have a persistently dry mouth, even if you just had a drink. This is especially true if you are taking medications. The other one is you have the urge to urinate more often and notice more difficulty when urinating. Other symptoms include unexpected weight loss or weight gain, and we often find patients who are craving carbs. This can often make your pre-diabetes symptoms worse. Next, you feel fatigued all the time. You always feel like you've lost your energy and you feel weak and tired. This can be even more dangerous if you are supplementing with energy drinks to help boost your energy levels. The next symptom is a little bit tricky. We sometimes have patients with blurry vision. Now, if this is happening to you, you need to get checked. Untreated eye problems caused through diabetes can indeed lead to blindness. Regular eye checks are important because blurry vision or other vision issues can be early warning signs not only of diabetes but of other diseases as well. For many of our pre-diabetic patients, they'll notice that when they cut themselves or have a bruise, it can take a long time for those cuts or those bruises to heal. Especially it's more noticeable in the extremities like the hands and the feet. Another reason to consult a physician is if you experience excessive itching or soreness in the genitals or you have frequent yeast infections. Now, these symptoms can often be a sign of too much sugar in your urine. There's a few other things you need to be aware of, but let's talk a few of the risk factors that you can have that will lead you to develop diabetes. In fact, there are different types of diabetes. There's pre-diabetes, there's type 1, type 2, gestational, and maturity onset diabetes. And depending on your age, lifestyle, and family history, you may be more susceptible to developing diabetes. This is especially important for these risk factors. Things like your family background, that could be a factor in developing diabetes. Diabetes can encompass a wide variety of nationalities. And that in and of itself does not guarantee that you'll be diabetic, but it does tend to make you more prone to have diabetic issues. So you should make sure you're aware of the fact that certain nationalities are at a higher risk for developing diabetes. Another risk factor is if you have a parent or a sibling that's been diagnosed with diabetes. If you're over the age of 45 and you're overweight, you might be at a higher risk for developing diabetes type 2. Next, if you're pregnant, you can be at risk of gestational diabetes. If you've just given birth to a baby over 9 pounds, that would also, you'd want to get evaluated for that. Next, patients with high blood pressure and abnormal cholesterol levels. Either high or low can increase your risk of diabetes. Now, if you have any of these risk factors, now's the time to make sure you get your child self-checked to rule out diabetic issues before they become a factor in your health. So that's just some of the things that we wanted to cover today, and we'll be going over more of this in the future.